use these screening tools for substance abuse to try and identify if maybe substance abuse is an issue that the juvenile is struggling with. In the simple screening instrument, you're going to see there's a list of yes/no questions. Some of them are, have you used drugs or alcohol in the last 6 months? And this simple screening instrument is based off the last 6 months of use. You know, have you had any of the followings, blackouts, or other periods of memory loss, convulsions, or DTs, hepatitis? Has drinking or drugs caused you problems between your family and friends? Just a real quick yes/no checklist of substance abuse related issues. And actually on the SSI it does touch on gambling. For a moment there is teenage gambling issues as well. What we're looking for is patterns in regards to frequency, length, and amount, consistency over time. The screening instrument will allow us on the back, there is a scoring mechanism. It'll tell us whether or not there is a need for further evaluations before making a determination as to what type of programming that an individual needs. The same is for the SARF, which is the Nebraska Standardized Risk Assessment Reporting Format for Substance Abusing Offenders. The SARF goes down age, prior record, offense types, attitude, personal relations, substance abuse, school, a lot of the same categories of the NYS and the YLS. It gives you a score based on yeses and nos. It doesn't give you a number score, but as you count up the yeses and count up the nos, it'll give you a low, medium, or high risk to reoffend. And these two screening tools are based on substance use and some non-substance abuse related offenses. So these take 5 minutes, if that, to complete both of them. With the SSI, you're actually sitting down with the juvenile and asking these questions. Some of our officers kind of get a little lazy and they do it after the fact. But you're supposed to be sitting down with the juvenile during the time of your interview and going through these assessment tools to determine, okay, is there a substance abuse issue that we need to address? In addition to the two simple screening instruments, probation also uses what's called the Adolescent Chemical Dependency Inventory, the ACDI. The ACDI is a set of 140 items. The first 100 are true-false. The next 40 are based on a Likert scale, which would be rare or never, sometimes, often, very often, or always. When the juvenile comes into our office, we bring the parents back for the interview, and the juvenile sits in our waiting area and completes this ACDI. So they go through all of the questions, and we tell them up front that the ACDI will screen for validity. It can tell if you're being truthful. So we always say, okay, answer these questions as honestly as you can, because we're going to know if you aren't telling us the truth. Sometimes they don't care and they just, everything is false and 1, 1, 1, 1, 1. So we get invalid results. We then will ask them to do it again. But it's very helpful. Not only will it identify truthfulness, it will also look at drugs and alcohol. It will also look at violence, distress, adjustment, stress coping, those mental health issues that an individual could be struggling with. I'm going to pull up an example of the one I have here in my hand. It's a result report on an ACDI that we did. It was a 16-year-old female. She was struggling, well, she struggles with mental health issues, but what brought her into the court system was truancy and shoplifting. You'll have a detailed report off of the ACDI results, and you can read through that when you have a moment. But basically what we see in the results section here is that her truthfulness was low risk, so she was telling us the truth. Her drug and alcohol scores were non-existent. She doesn't have a problem there. Her violence, low risk, but as you can see, her distress and her stress coping were very high, especially her distress. Her adjustment was somewhere in the middle. Her age at first arrest was 16, total times arrested, this was her first time. Go down here. Okay. The first page talks about the truthfulness, and it's letting us know that she's low risk, meaning she's telling us the truth. The alcohol and the drug is also low risk, but what's interesting here is when we're going through and we're making our recommendations to the court, we're taking the results of the ACDI into consideration. And it's basically telling us right here what we should recommend in these domains. With regard to alcohol abuse, the least restrictive disposition consistent with public safety is recommended. Same thing with drugs. Let's get back down to this. Okay, distress, maximum risk range. This is what it says to us. Recommendations, this youth should be referred for further psychological evaluation. If appropriate, mandatory attendance and compliance and treatment should be considered. Probation that is consistent with treatment and public safety is recommended. Prompt intervention is recommended at this is a very troubled youth. In regards to this particular case, I will let you know that she was actually involved with a lot of therapeutic interventions on some pretty heavy meds. She was on like 5 different medications, had a lot of distress, anxiety, depression. This is also the girl, though, that eventually started using with her 19-year-old boyfriend, so she has now gotten into the worlds of drugs and is skipping school. Somebody who started out relatively low risk has started to escalate up the scale. A lot of it is due to her mental health issues. She struggles horribly with self-esteem issues. She had a violent attack when she was 15. Her boyfriend date raped her and left her out in a cornfield. So this young lady is dealing with a lot of issues. She a behavior problem per se? Not really. She's just dealing with a lot of life circumstances and mental illness. Near the bottom of the report, it will identify significant items. Significant items it pointed out were distress, unhappy with life, frequently discouraged, feels alone and unhappy. Last year, unhappy and depressed, wants to give up on everything, states unhappy and needs help, thinks about death and suicide, states, I need help, wants to talk with a counselor. Adjustment, she's more unhappy than aged peers, needs someone to talk to, unhappy at home. So it's letting you know what the flags are and where your concerns should be, which will help drive your recommendations. And then it also talks about some of the areas where you don't necessarily have to focus on as far as concerns go. Drinking is not a problem. There's no need for alcohol treatment. Not a recovering person, denies any family problems, and so on. So that's the ACDI. It's a very helpful tool. So it not only helps you develop a plan for drugs and alcohol, it helps address mental health issues as well. And it helps you to develop that part of your case plan or your recommendations.